Since 2005, Michael Bentley has been leading SierraSil Health in Vancouver. He has led their marketing endeavors, and he is the best advocate and spokesperson for the product. And he has joined with others to be an advocate in the marketplace and in legislative corridors throughout Canada for natural healthcare products. In 2019, Michael, a Vancouverite by birth and a very proud one, was honored with a leadership award by the Canadian Health Food Association and lauded with many kind words, including those of MP Joyce Murray, who said, "Michael is an effective communicator and advocate for good public policy so the public can retain access to natural health products along with the information about them." Recently, in Exit 425, our MP, Jamil Jivani, sent out a flyer about how Bill C-368 had passed second reading in the House of Commons and asking for feedback about the protection of natural health products. Michael is meeting me here at Exit 425 to explain what Bill C-368 is all about and why advocacy at the federal level is important for natural health products. I've known Michael since 1980, 44 years, so if I refer to him as Mike, please forgive me. Michael, welcome to Exit 425.
Thank you, Steve. I can remember when we met in September 1980 in the middle of the night with you dropping your hockey equipment right at the foot of my bed. So I got to enjoy the wafting smell of it by morning time. But after that, I mean, I'm just so delighted that we became really good friends, and we've shared lots of happy memories together, including being at each other's weddings. Listeners, you might know that Steve was the best man at my wedding, and that was an appropriate description. And we've just remained lifelong friends despite being 3 time zones apart.
Exactly, and I appreciate Mike, your willingness to come on and talk about this. I know this is your product, SierraSil, and the area that you work in is not just a job or a business, but it's a passion. And so I appreciate you taking the time out of your day to do this. And so let's get on. Bill C-368 is an amendment to the existing Food and Drugs Act. What is this meant to do? And please explain it like I'm 7.
Okay, well, let me first provide some context, then say what the bill does, and then what the implication is, if that's all right. So some context is we've got regulations for natural health products in Canada, like your health supplements and so forth, that came into effect in January 2004, and they were generally regarded as perhaps the best regulations in the world for natural health products. Later, that directorate, that supervised them in Health Canada, called the Natural Health Products Directorate, was expanded to include non-prescription drugs and became the Natural and Non-Prescription Health Products Directorate, NNHPD. And it basically looks after every personal care item that you might have in your bathroom and in your kitchen cupboard, things like toiletries, hand sanitizers, supplements, and those non-prescription drugs. And the role of the department is to ensure that Canadians have ready access, and I'll quote them, to natural health products that are safe, effective, and of high quality, while respecting the freedom of choice and philosophical and cultural diversity. We seem to be migrating away from that role in terms of what's happening in terms of the regulatory changes. But the process in 2014, you might recall Vanessa's Law was introduced. That was in honor of 15-year-old Vanessa Young, who died from a drug that Health Canada was having a tough time pulling off the market. And so Vanessa's Law gave the minister powers of recall for so-called unsafe drugs. There's a history of those, like Vioxx was, people might recall, and even one of the first COVID vaccines was recalled because it was deemed to be unsafe. But then around 2016, Health Canada started to make more changes in what they called their self-care framework. And I have to say the stated objectives are good, but it's the practical applications of it that are contrary to the stated good objectives. So in 2023 and 2024, the government introduced further changes through budgetary bills, which was really an odd way to do it, to make changes to natural health product regulations through a budget bill. But that meant they bypassed health committee. So health committee didn't get a chance to look at them. And the key change there was to extend Vanessa's law to natural health products, to include them in the same categories basically as drugs and medical devices. So what is Bill 368? It's simply an unwinding of natural health products from the definition of therapeutic products, which just leaves drugs and medical devices in that definition. And where it's at is it's now past first and second reading as per the circular that you received. And the next step is for it to go to Health Committee for review. That could be sometime in the fall, or it could be next year. We don't know when it will come up to Health Committee. But after it's gone through Health Committee and they send it back to, and Health Committee is made up of MPs of all the parties, it goes back to the House of Commons for third reading. If it passes at third reading, it then goes to the Senate, and the Senate would review it, and if it approves it, it then moves forward as law, and natural health products would then be exempted from Vanessa's law. And so simply the implication is Health Canada wouldn't have the power to ask the minister to have a recall of natural health products. But then again, they have that effective power already. They can issue stop sales, they can issue notices to the public and so forth. It's very different than a drug because the natural health products are really in the public domain, and the powers of the recall by a minister are at this point untested. So really what's more important from the industry perspective is not so much having the natural health products exempted from Vanessa's law, but the signaling that it has to our government as well as to Health Canada to say, hey, slow down on these changes because they're having unintended consequences and they're not achieving the objectives that you are seeking. So that's kind of a simple background for it. I would say sort of sadly, all of the government MPs, except for a couple who have abstained, voted to keep natural health products within Vanessa's law, which would fail to send that overall signal. But interestingly, all the opposition parties, even those who was introduced by Blair Calkins, who's a member of the Conservative Party, the Bill 368 had the support also of the NDP and the Bloc. So it was unanimous amongst the opposition parties, which is really a positive thing.
So even quicker and dirtier summary is taking healthcare products out of that law that allows the minister to stop the sales. But if there's something bad, the minister already has the power to stop the sales and stop the distribution of a health product that might be deemed as unhealthy or unsafe.
Yeah, I would say not so much the minister, but at Health Canada. They can issue stop sales, and they have done that. We're not living in a vacuum. I mean, if Health Canada does an announcement that, Acme hand sanitizer is not safe, the news gets out pretty quick. And so they have de facto power right now of recall because the retailers don't want to sell anything that Health Canada said is not safe. And companies expose themselves to liability if they leave it on the market. So that power already exists. It's not needed in Vanessa's law. And that's why this is more of important from a signaling point of view than it is from we'll call it a technical point of view.
Excellent. You're a passionate advocate for SierraSil as well as other NHPs, natural health products in general. And Joyce Murray, 5 years ago, referenced your efforts to influence policy to protect the public's access to natural health products. Why does that access need to be protected? And is it threatened?
So it's a good question. I think as long as there's an internet, people will have access to products because they can buy products from anywhere around the world for personal importation and get them, or they might have a family member traveling and they can pick up whatever it is, bring it home in their suitcase and say, yeah, I've got some, declare that they're bringing in a whatever under the personal importation. So Canadians have access to product. The question is, do we want Canadians to have access to product that Health Canada is regulating? And do we want Canadian retailers, distributors and retailers to be able to be in business selling those products? And there was a survey done by one of the major auditing firms that showed that 1 out of 5 products is likely going to be lost to the market through conventional channels. And there's one major U.S. company that's also in the pharmaceutical business, but has a consumer products division. They make supplements and they make other things that you'll find in your kitchen, including various supplies. They said they're thinking of pulling 75% of their products from the Canadian market. And instead, what they would do is they would just sell them through the internet to Canadians. So the question is, how is that protecting Canadians? It's hurting Canadian business because that independent Canadian retailer often is a franchisee or a lot of immigrant families and so forth, or in that business. You're hurting the retailer, and you're reducing Health Canada's reach because the product that's going to be sold directly to the consumer doesn't come through Health Canada, doesn't have Health Canada authorization. So there will be access, but there will be clearly less product that's actually regulated by Health Canada reaching Canadian consumers, which is clearly contrary to the stated objectives.
And I mean, some countries just don't have the precautions for things that are made in their country that Canada has. And so we run the risk of maybe some sort of pesticide or herbicide that's used in another country getting into that product. And that could be obviously a negative effect on whoever uses that product.
Yeah, in the U.S. they have regulations through the FDA that follow good manufacturing practices, GMP, and so forth. Companies there are also subject to audit by the FDA, but they don't have pre-market approval. There occasionally you hear products that are deemed to be unsafe, but they tend to be products that are falsely marketed as natural health products. It's not a natural health products issue. It's strictly a marketing issue. For example, there was a sleep product whose legal case is just finished, but when it was discovered that there were actually drugs in this product, that it was actually a drug product being falsely marketed as a natural health product, that the sale of that stopped immediately. Retailers stopped selling it. Word got out in a hurry, and it basically was removed from the market. So that power already exists.
The regulations exist that limit the ability of a company to sell snake oil as a health product. Is that correct?
Yes.
And that's good.
Yeah, it's good. The industry supports that. We want good regulations. We've had good regulations since 2004. Before, I'll just say Ottawa in general terms, whether it was political, whether it was bureaucratic, thought we needed changes. And I will say up front, some of the changes make sense to me in terms of more clear labeling. The challenge is fitting what is being sought onto a label without wasting resources. And increasing costs through larger labels, peel back labels, larger bottling. It needs to be worked through better than it has been. And the industry, through the Canadian Health Food Association, has said, we're happy to meet and work through these, bringing in a consumer products group. Let's look at what you're trying to achieve and try and do it in a way that doesn't hurt Canadian retailers, doesn't have a severe impact on the number of products actually under Health Canada's oversight reaching Canadian consumers, and so forth. But the frustrating part is that the government has not only been reasonably deaf to the concerns that our industry association has raised, as well as to the largest letter writing campaign that the House of Commons has seen in over 10 years, a larger campaign than guns, pharmacare, internet censoring. This has been definitively the largest source of feedback to MPs in the country in over 10 years, apparently. And the government, not only are they seeming to close their ears to it, but they're parroting information that is unsubstantiated and in some cases totally irrelevant. So, for example, there's an MP talking about, well, we need this because of a hand sanitizer, citing an example of a hand sanitizer that had some ingredients that were undesirable and needing to pull them from the market. What does that have to do with supplements? They've also cited a reference of the number of adverse events. Well, first of all, that number is unsubstantiated. They say, go to this website to find out. Well, you can't find out through that website. And just because something, even if the number is right, which it's suspected it's not, but when an adverse event is filed, everything that the person takes or uses is included in it. So if you got sick from, we'll just say, an old yogurt, you go into the cupboard in terms of the investigation, oh, there's vitamin D and there's vitamin C and there's aspirin or whatever. All those can be considered part of an adverse event report, because one of the questions is, what medications are you taking? And so it's really frustrating dealing with a government that doesn't seem to respond to this significant campaign from literally tens or hundreds of thousands of Canadians, as well as the industry association, and saying, we just want to help get this right. And so a logical question, what does getting it right mean? It means pausing the changes and mitigating the negative consequences to what the plan changes are doing, so that we can find that ground that achieves what Health Canada wants without damaging Canadian industry and without creating the unintended consequences of more unregulated product reaching Canadians.
Is there an ulterior motive?
It might be fun to speculate on what the ulterior motives are, whether there are any, but I think it's more important to ask listeners, to ask their Liberal MPs in particular, why are you leading and supporting changes that will tilt the health product marketplace to non-Canadian registered products that bypass Canadian retailers? That would be a simple question. Another question is, given the practical effects of the changes, how will those changes protect Canadian consumers? And then a follow-up is that the best way to achieve that? Ultimately, what that MP should be doing is asking our health minister to just pause the changes until Health Canada can come back with a plan that mitigates the concerns that have been raised by literally tens or hundreds of thousands of Canadians as part of the largest feedback campaign that MPs have heard in the last 10 years. And fix it so that their concepts that they want to implement have far reduced negative consequences.
And our MP here is actually wanting us to add to that feedback. So, he's petitioned us, the residents of Durham, to send him some feedback about wanting to protect natural health products. So our voices will join in that. And those are good questions. We have a conservative MP here, but that doesn't stop anyone from emailing a liberal MP somewhere or making contact. So
yeah, and I have to say, with various visits to Ottawa on behalf of the Industry Association, that there are a number of good MPs. And I think some of the government MPs feel stuck by the messaging they've been given to share. And the main opposition party, the Conservatives, have been outstanding on this. The health critic, Dr. Stephen Ellis, I've just been very pleasantly impressed by his grasp of the issues, his passion and his compassion around this. Really, and I'm not alone. I've heard some people who've claimed to be lifelong liberals who say that they're switching, if nothing else, because of how the government has acted on this, and how impressive the opposition has been in responding to it and actually listening to Canadians. So the NDP health critic, Don Davies, has also been strong on it. But their party has a little bit of a limitation due to their support agreement with the government. Although, to their credit, their MPs voted in favor of Bill 368 to exclude natural health products from Vanessa's law.
So let's think about the benefits of natural health products. We've talked about the legislation a fair amount and some of the ins and outs of that, and we're going to kind of get back to that and maybe give you another crack at the safety issue. But how can natural food and health products help provincial and federal health care budgets without actually having the governments pay for the products?
It's a great question. And one of my volunteer hats is with the Canadian Health and Fitness Institute. And I wanted to say, to start with, I'm not anti-drug. Drugs can play an important role, very important role in people's health and recovery from serious illness. But ultimately, a medicated nation is not necessarily a healthy nation. We need to be striving towards a healthy nation. People who are choosing healthy diets and exercising, trying to get a good night's rest, drinking plenty of water, all those things are really important. And supplements can play a role in that as well. In the case, for example, of SierraSil, we have patents as a nutritional supplement for osteoarthritis. And the head rheumatologist of our largest hospital here in Vancouver says, as part of demedicalizing treatment, he's trying to encourage the healthy lifestyles. And he's also found that his patients using SierraSil have a very positive response within 1 to 2 weeks. And they're often using SierraSil in place of a very expensive drug. So clearly that is saving the government money through insurance programs and so forth. There are other applications. For example, Crohn's colitis, irritable bowel syndrome, irritable bowel disease, traditionally treated with steroids, serial surgeries, or biologic drugs. I think it's possible that a combination of natural health products could probably, for some patients, not all, but for some patients, provide the relief that the biologics are currently doing. And we certainly have anecdotal evidence of that, but not clinical evidence at this point, I'll point out. But again, tying to clinical evidence and an example, a young man with juvenile arthritis who I know He's in his late 20s. And he said before SierraSil, he never could remember a period in his life, a sustained period in his life without pain. And he's actually eliminated one of his medications and halved another. And that's really good news that this young man now is feeling better most of the time. And he's reduced his dependence on drugs that came with side effects. That's exciting. So I really do believe that as part of an overall healthy plan, that supplements can play a role, improving outcomes and reducing costs.
Less downtime at work, maybe more time for a young person to be at school, fewer hospital and doctor visits. It all adds up in terms of the bigger picture. So that's great.
Yeah, even a
Go
study
ahead.
out of Harvard that looked at physicians over a 20-year period with something as simple as a multivitamin, and there was a tangible reduction in cancer risk or cancers amongst the physicians using a multivitamin. Now, there may have been other factors. Maybe they were pursuing healthier lifestyles as well. But we do know of concrete examples with, for example, SierraSil, including, for example, a neurosurgeon who delayed a hip surgery because he said SierraSil was more powerful for him than the drugs he had been on. And a week ago, we got an email from a gentleman in Edmonton who was going to be having knee replacement surgery, but his orthopedic doctor said, at least just give SierraSil a try. This is what he wrote to us. He tried it, and he says 4 years later, my knee is just fine. We're not even talking about knee replacement surgery. So improved outcome, reduced cost.
There you go. Is natural health product safety a concern? And this goes back to some of the other things you were talking about earlier about regulations and too many regulations and that sort of thing. So is too much concern and regulation a bigger issue than just access for Canadians to natural health products?
I'm not sure that I said we had too much regulation as opposed to, well, maybe it is too much in some regards, but regulation is important. And the enforcement of the regulations, the appropriate enforcement of regulations is important as well. We've had very good regulations in Canada since 2004 for natural health products. The industry doesn't see a need for radical change, but is prepared to work with the government to accommodate some of the objectives that the government is seeking in a way that doesn't effectively, we'll say, half destroy the industry. So, are health supplements safe? They're generally pretty safe. I'm just trying to think back to, the cases in Canada where we've had reported side effects, and the only ones that I can think of offhand are ones that were drugs incorrectly marketed as natural health products. Or at least those are the two most prominent ones that come to mind for me. In the overall scheme of things, they're unbelievably low risk. When you consider, for example, and I'm not saying these aren't good products, but we have OTC pain products, acetaminophen, ibuprofen, that you can get in large bottles. Those bottles in Europe are sold through blister pack only because of the side effect risks of those products. So we have, apparently, according to an article I saw in the Toronto Star a while back, 100 young people dying from acetaminophen poisoning every year. That's literally 100 times more than the number of people dying from a supplement per year, or infinite, because if you're not having anyone dying from your health supplements, why is that not the subject of attention and say, we don't want to ban these products because they actually are pretty effective when used as directed, but we're going to change the packaging so that there's less risk of overdosing from them and more clear warnings about what are the risk factors, for example, by taking acetaminophen and alcohol at the same time. So again, it comes back to where are the priorities, where are the budgets being spent relative to the risk factors. And with the resources being put into regulatory change for natural health products, when we already had good regulations, one has to ask, is that the best use of resources? Or would it be better to put that into training inspectors so they could do an appropriate job being out in the field, inspecting production, checking with the Canadian Border Agency on what's coming into the country and so forth. That, I suspect, might be a better use of resources to reduce risk for Canadians.
So, a balanced approach in terms of minimizing that snake oil effect, and anybody just taking anything and marketing as something. Obviously, purity and the healthy nature of something has to be considered. So all those things on balance produce a good situation. What you're suggesting is that we've been in that balance and we've been in a good situation. So as an industry, how do natural health products people feel about the testing, certification, and regulation? I gather from what you've said already that, again, that balanced approach is something that's acceptable, even desired, to kind of keep away that idea that, again, you're snake oil salespeople.
Yeah, responsible producers don't like regulations. We don't want somebody coming on and says, this cures cancer. And as a result, someone defers appropriate modern treatment and tragically dies when maybe going through appropriate medical treatment could have saved their life. Obviously, we don't want that. I don't, like, the people I know in our industry aren't anti-drug, aren't anti-Western medicine. Generally, we're pro-health. And yeah, there's some people who are just anti-drug, period. But you're going to have people with strong opinions in every field. The mainstream within the natural health products business supports regulations, wants regulations, and wants proper training of inspectors and of Health Canada staff so that the regulations can be implemented effectively.
Michael, thank you for meeting me at Exit 425. How can people reach you or find out more information about natural health products, including SierraSil? So
a great resource is the Canadian Health Food Association, chfa.ca, CHFA, Canadian Health Food Association.ca, and then you can click on advocacy and learn more about what's happening with that. Another organization is called the Natural Health Product Alliance, NHPPA.org. They've been very active on this as well. I think their leader is Sean Buckley, a lawyer from Kamloops. People can see what parliamentarians have seen and said on this by going to openparliament.ca, and just search Bill 368. And you can see what MPs of all major parties were saying on it. And it's kind of an interesting read. And if somebody has some questions about some of the things that some of the government MPs were saying, I'd be happy for them to reach me at mbentley at SierraSil. Sierra's with an S, like the Sierra Mountains, and then SIL.com. So mbentley, as in Michael Bentley, mbentley at SierraSil.com. Or if you don't remember my name, which is fine, you can also do info at SierraSil. Again, SIERRASIL, Sierra, like the mountains, and then SIL.com. sierrasil.com. So info@sierrasil.com. And if I could just offer a quick recap as well. The regulatory changes that are being made are contrary to the stated objectives in terms of their practical impact. They're also being done in part through backdoor channels, which is completely inappropriate, but probably so to avoid discussion in Health Committee. And Bill 368 is important more so as a signal to the government and to the bureaucracy, hey, come through the front door, let's properly discuss these changes so that we don't have unintended consequences. And it's really important for people to continue that campaign. I really appreciate the listeners who have written to their MP, so thank you to them. But to continue to ask the MPs, what are you doing about this? What are you doing to maintain access to Canadian regulated health supplements, particularly the government MPs? Because regulated supplements, the access to them is at risk. We've heard from companies that say they're just going to bypass Health Canada completely. They're going to pull products out of the country and rely on personal importation, as well as companies with interesting new products that might be of interest to Canadian consumers. They're not even bothering going through the front door. They're just going to go personal importation. And it's a big issue. There are companies doing that and warehousing product in Canada contrary to the regulations and selling to Canadians. And it's because we have a regulatory environment that's now going beyond the practical good regulations that we had in place and stretching to achieve more, which may be good, but the consequences are really not good. Bottom line, just for listeners, be out there, be healthy. You follow Steve's example, get out on your bike, wear a helmet, be your healthy best, get your sleep. And if you got sore joints or muscles, yes, SierraSil is going to work for you. And if not, we'll give you your money back. So there you go. Thank you for listening.
That's awesome. Michael Bentley, SierraSil Health, thank you so much.
It's really a pleasure. And I really do welcome any listeners. You can forget my name. Just remember info@SierraSil and reference Steve or the Exit podcast, and I'll get it. Thank you.
Thank you for listening to this episode of Exit 425. Please like and subscribe on your favorite podcast platform and on YouTube. Our mission is to provide substantial information and education that goes where you want, because it's where we live. Exit 425 is a production of Studio 38 Audio, copyright 2024. My name is Steve Ray. If you have any questions or would like more information about Exit 425, join our Exit 425 Facebook group, like the Facebook page, check out Instagram, Medium, LinkedIn, X, and TikTok, or email me at exit425-401@gmail.com. Exit 425. It's where we live.
Powered by Riverside FM.